Delivering a baby is a heavy responsibility, especially for women in rural areas who opt for home deliveries. One such woman is Mary Njuguna, a mother of 3, whose life was all rosy until she gave birth to her 3rd child.
Mwezi wa 6 wakati nilikuwa najifungua mtoto. Sasa leba yangu ikakaa sana. Alafu sasa ndio nilijikuta nikiwa na shida kama hii.
Obstetric fistula is usually the result of obstructed labor coupled with the lack of appropriate medical intervention to relieve it.
Labor for 3 days, 48 hours, 24 hours. Before now they seek medical advice. By the time they reach in the hospital, now when they go through, they don't have that baby. The baby is already gone. And then after the delivery, immediately they start leaking urine. There are those who leak urine and stool both. The mechanism, the hand places the blood, and that friction wears out the muscles until it creates a hole.
It is a preventable condition which disproportionately affects very young and very poor women, usually living in remote areas due to early childbearing, pre-existing malnutrition, and limited access to emergency obstetric care. Harmful cultural practices also promote the condition.
You get married to a family where everybody delivers at home. They ask them such a question: who are you to be taken to the hospital if the rest of women here deliver too? So again, tradition, religious beliefs.
Patients with fistula are stigmatized by the society, thus they rarely talk about their conditions for fear of disgrace.
People won't tell you they are not sick, but the problem, they are smelling pieces and the stool. Very hard for somebody to tell you, I've got this problem of smelling urine, my urine is coming out, my stool is coming out. Unless now we repaired, we went into India, we hold camps so that people, those who have, after you treat them, they also go back to the village and they say, this disease has got a cure.
Many have been neglected and some even divorced by their husbands, which however is not the case for Mary.
Sikuwa naona kama ni ugonjwa mtu anaweza pona. Hata watu walikuwa wananiambia sijui kama nitapona, lakini sasa bwanangu alikuwa anatia moyo.
Men too can also get fistula when they get involved in an accident or a fall that can injure their private parts.
You can have through accident, but right away we refer men to urologist clinic.
After the surgery, one must follow the doctor's advice to the letter lest the condition recurs.
I remember a history of one patient we repaired up to 16 times. They have to stay without family planning method. They have to abstain for 6 months. Then after that, if they all as closely completely, we tell them after delivery. One, they have to deliver in a main hospital, and it has to be through cesarean section.
Experts are urging the government to put proper policies in place to curb the rise in the condition, which has dropped drastically due to concerted campaigns and reduced treatment charges.
Some doctors are still training more. We are going outside Kenyatta. There are camps all over. It has improved so much, and still with no cost.
And the health workers also don't know about fistula. And we have to embark on a lot of public awareness creation so that people learn about fistula.
From cases of survivors like Mary Njuguna, who after successful treatment is about to go home and pick up the pieces of her once broken life, there is hope for women with fistula. Stella Kaleche for Health Matters.